starting to look at the heart. Well, what is it, where is it, and what are all the functions of it? I'm sure you can probably guess it's located in the chest, it pumps blood, but there's more to it than just that. All the different structures, all the different parts and pieces, and the how. How does it work? How does it control itself? That's what we need to get into throughout the heart lectures. So when we start looking at the heart initially, the location is pretty much mid-chest, but a little bit offset to the left. When you're looking at it here, you can notice it's nestled right in between the lungs. Now, it's not an even nestling in between. If you notice, the apex down here kind of points down to the left, which causes a little bit less space inside your left lungs. So surrounding the heart is a pericardium. Now, there are different layers of the pericardium. We'll start with this fibrous pericardium. It's the most superficial of the layers. This superficial fibrous pericardium, it's meant to help anchor the heart in place, help protect it. Not protect it from things getting into it, but also protect it from overfilling and getting too large. Because it's a physical structure around the heart. So as the heart fills, it can only get so large until this fibrous pericardium prevents it from getting larger. Now, deep to that, there is going to be this two-layered serous pericardium. Now, if you think back to AP1, remember about serous membranes, that very first chapter, there was the parietal and the visceral. It's a two-membrane system. So what you're seeing here is the parietal layer. This is the one that's lining the internal surface of the fibrous pericardium. So you have this containment, this fibrous pericardium, lining the inside of it, so touching the fibrous pericardium. That's the parietal layer. So it's the one that's lining the cavity. The visceral layer, that's the one that's tight to the heart. It's wrapping the heart like saran wrap. So it's tight to the heart itself. This is this two-membrane system. Parietal lines the cavity. Visceral is tight over the organ. Now, both these are separated by a fluid-filled space. Now, this fluid-filled space is pretty small, pretty thin. It's not like it's inches wide. It's a thin layer between the visceral and parietal pericardium. So if you're looking at this blown up picture here, you can see the heart, take that and blow it up. So what we're actually looking at here is this outside portion here. That's the fibrous pericardium. It's thicker, it's stronger, it's meant to be more protective for physicality force. So a physical force. Think about heart expanding, things getting through. While just inside of it, this layer right here, that is the parietal layer of the serous membrane. It lines the outside of the cavity. Then beyond that, you'll notice the pericardial cavity. The pericardial cavity is what is fluid filled. It's in between the parietal and the visceral layers, which leaves the visceral layer, which is right here, also known as the epicardium. It's the most external layer of the actual heart itself. So if you notice the two layers, you have the two layers of the pericardium, the visceral and parietal layer, are enclosed inside of it, having that liquid, that pericardial cavity. So why do we have the pericardial cavity? What's the benefit of it? Well, by having that fluid-filled cavity there, it helps reduce friction. The visceral and parietal membranes are covered with that thin fluid layer. So as the heart beats, they slide past each other in a virtually frictionless environment. I mean, think about it. Your heart's beating, give or take, 70 times per minute, 60 times per minute, 80 times per minute. It all depends on your individual anatomy. But every time it beats, now times 60 minutes an hour, times 24 hours in a day. Think about how many beats that is. times a week, times a month, times a year. You get the picture here. It's a lot of movement. You want to make sure you're not damaging the tissue by creating friction every single beat. So this visceral and parietal serous membrane help to reduce the friction, protecting the heart from the constant movement that's doing over and over your entire life. So let's go a little deeper in there. The next layer down is all the cardiac muscle. Now this particular image, you're seeing how it kind of looks like it's rounding around and making a loop. Well, the reason being is it's surrounding the different chambers of the heart. You'll notice up top, this muscle is surrounding the two atria, the two upper chambers. Down below, the way this is wrapping around, it's curling around the two ventricles. So it's making sure that each chamber, when the cardiac muscle contracts, it can squeeze the blood out of the chamber, compressing the chamber. So it's not just simply covering the outside, it's creating certain structures to maximize its contraction, to get the job done basically, to move the blood out of your heart. So I already mentioned atria. Your heart has two atria, a right and a left atrium. Now, these are going to be separated internally by an interatrial septum. So right in between the two atria, there is going to be this layer, this wall, this interatrial septum. It's meant to keep the blood on the right side atria and the blood on the left side atrium to be separate. So, well, what does it make a difference? The blood on the right side is what's coming back from your body. That's the oxygen poor. The left side is what's coming back from the lungs. That's the oxygen rich. So you want to make sure that you're keeping these two different blood flows separate so you can have all the oxygen rich blood being sent out to your body and not picking up that oxygen poor blood. Now the term auricle, and watch the spelling on that, it's A-U, not O. So the auricles are found externally on top of both of the atria. It's a way to increase the volume of the atria because the blood can be pumped or pushed into the auricles or even flow into the auricles to allow for an increase in volume. Mentioned there are ventricles. Two ventricles, you have the right and the left ventricle. Now, just like the atria, they are separated by the interventricular septum. It's meant to keep the right side, which is the oxygen poor again, and the left side, which is the oxygen rich, separate. Making sure that all the blood that comes from your body into the right atrium and down to the right ventricle can then go into the lungs. All the blood that comes from your lungs back into your left atrium and left ventricle can then get pumped out into the rest of your body. So you're trying to make sure you keep the blood from mixing, keep it separate. Oxygen poor right, oxygen rich left. Now, you also have this interventricular, this posterior interventricular sulci, anterior interventricular sulci. It's kind of a little indent in the heart. It helps you identify where that actual septum is. So the right and left ventricles can be identified from an external view. So two ventricles, two atria. The atria, they're all about receiving blood from the body. So all the vessels that lead into and connect to the two atrium are always receiving blood. The only way blood leaves the atria is going down into the ventricles, at least for normal anatomy, I should say. So vessels entering the right atrium. Now the right atrium, you have the superior and the inferior vena cava. The superior vena cava is up top, superior, above. Head, shoulders, arms, all that blood is drained back into the heart via the superior vena cava. Inferior vena cava comes up from the bottom. So the legs, the hips, the torso, all is feeding up into that inferior vena cava. Those are the two main vessels that drain blood into the right atrium. But there is a third, this coronary sinus. Now the coronary sinus, coronary referring to heart, sinus, cavity. So you're literally thinking heart cavity here. Well, that's true because your heart is draining all of its blood from the coronary circulation into the coronary sinus. I mean, think about it. Your heart is a giant muscle. Just like every other muscle, that cardiac muscle needs oxygen to function, which means you have blood that flows into the heart muscles from the arterial side, and then once it's used, all the venous return comes back into the coronary sinus, back into the right atria. So 3 main vessels, superior vena cava, inferior vena cava, coronary sinus, all drain into the right atrium. Now the left atrium, you have the right and left pulmonary veins. Veins, they're blood's flowing to the heart, flowing back to the heart. Well, pulmonary means lungs. Pulmonary veins is the blood flowing from the lungs into the left atria. So all that oxygen-rich blood now is flowing into your left atrium. So the 2 atria, blood's flowing into them. So looking into the ventricles, the walls of the ventricles have this trabeculae carne. It's a muscle. It's woven throughout the walls that helps with contraction of the ventricular walls. Helps give a little bit of force when you start to pump the blood out of the ventricles. Papillary muscles. Now, these papillary muscles, they'll be cone-shaped and kind of sticking out into the actual ventricle itself. It's really meant to help anchor in place. So these muscles are helping to anchor structures like the valves in place, as well as contraction of the actual wall. Because all of this blood needs to be pumped out of the ventricles. So the right ventricle is going to have 1 vessel leaving it. That's it. All the blood from the right ventricle pumps out the pulmonary trunk. Now the pulmonary trunk could be called the pulmonary artery also, because a trunk in this case is an artery. Now this pulmonary trunk is the only way of getting blood out of the right ventricle. The pulmonary trunk will branch into the right and left pulmonary arteries, but the only way out is the pulmonary trunk. Left side, we're looking at the left ventricle. The only way out of the left ventricle is the aorta, which goes up and then curls back down. The aorta is the only way of getting blood out of your left ventricle. So the 2 atrium, the 2 ventricles, about getting blood in the atria, blood out the ventricles.